That all brings us to a larger look at what can be done in the U.S. to protect frontline workers and lessen the spread of COVID 19. Dr. Atul Gawande writes about very specific lessons he sees from Hong Kong, Singapore, and South Korea. Dr. Gawande is a surgeon at the Brigham and Women's Hospital in Boston. Dr. Gawande, thank you so much for talking with us. You have been looking at lessons learned possibly from Asia. What are you finding?
First, understand what we're seeing in Italy is that the hospitals themselves have become a source of infection. By contrast, in Hong Kong and Singapore, they were able to control the infections very effectively. They had a playbook, and it worked. It managed to keep infections spreading inside hospitals to patients or to clinicians, and so we need to follow that playbook.
What did you see?
Well, first of all, they started by saying when you come in to work, they would do a health check to every healthcare worker to see, do you have any symptoms like a fever, a cough, or any other kinds of flu-like symptoms? And then you would have to stay home. Number two, everybody wore a surgical mask when they came into work and kept that mask on all day, partly for the protection of the healthcare worker, but also because we are picking up infections in the community as workers ourselves, and we don't want to spread it to colleagues and to others. There's a third one is that you really need to separate the respiratory patients in their own clinics, in their own wards, if you have a respiratory symptom, from the people who have non-respiratory symptoms. Keep them out of the different teams, different line of traffic. One of the interesting things, it also shows us that you don't have to be totally draconian. In Singapore, for example, they only sent you home to be in quarantine if you were within 6 feet of the patient for more than 30 minutes with no mask on. But if you have a brief momentary exposure within 6 feet to someone who had coronavirus, that you don't have to fear that is necessarily going to cause the same spread. It comes from substantial time together.
So the duration of exposure, you're saying, really could make a difference?
The duration of exposure and how close you were. What happened in Wuhan after lockdown was it was 3 to 4 weeks later that you hit the peak of the overrun of the hospitals. Then if we are successful staying at home and locking down the way we have, we should see that peak starts to come down and that we start seeing evidence of that. We'll hopefully have testing moving and more supplies. I expect that in the next 2 to 4 weeks, we'll understand whether these combination of measures keep us from infecting fellow colleagues and getting infections from patients.